Hi, welcome back to your prescription for medication education, where I try to bring you quality information regarding medications and health-related topics and make myself just a little bit better as a pharmacist with every video. In my last video, I covered topical semi-solid dosage forms. Today, I'll be continuing with topical liquid formulations. So for topical solutions, these are clear, homogeneous liquid forms that are intended for external application. They can contain aqueous or alcoholic solvents. They are free-flowing and some may have gelling agents added to them to thicken the solution. Topical suspensions are liquid forms consisting of solid suspensions in a liquid vehicle in a two-phase system. They consist of aqueous or alcoholic solvents and require shaking due to the settling of their solids. Lotions are emulsified liquid dosage forms that are mostly used for external skin applications. They are more fluid than semi-solids, which allows for easy application over large skin surfaces and allows them to be poured from their containers. Lotions often contain preservatives to prevent microbial growth due to their aqueous nature. Shampoos are designed to be applied to the scalp and hair, followed by rinsing after application. They can be medicated or non-medicated. The medicated shampoos combine cleansing and degreasing properties of the shampoo with the active pharmaceutical ingredient. Shampoos can be solutions, emulsions, or suspensions and create a foam when water and rubbing is applied to the scalp. Shampoos usually contain synthetic detergents or surfactants. These compounds are amphiphilic, which allows the lipophilic sites to bind to the sebum and oil and allows the hydrophilic ends to bind to water for easy removal after rinsing. Shampoos often contain preservatives as well. Foams are emulsions which, upon dispensing from their container, form a gas in a liquid frothy semi-solid consistency. They can be formulated from aqueous or non-aqueous liquids and contain surfactants and propellants. The propellant can be in the continuous or non-continuous phase. This determines what the foam's physical characteristics look like upon dispensing from the container. Propellants in the continuous phase will often form a foam that collapses into a thin liquid as opposed to propellants that are formulated as part of the non-continuous phase, which will form a foam which is much more stable. Foams often contain flammable components, which makes it important to keep them away from heat sources. Another common topical dosage form are film-forming systems, which are often used to treat nails. This formulation is not restricted to the use of nails and can be applied to various parts of the body, but I figured now would be a good time to discuss its formulation and its common use in onychomycosis. The nail plate, also referred to as the nail body, consists of about 25 layers of hard keratinized cells organized in a lamellar pattern. This results in reduced drug diffusion because the nail is poorly permeable. Our nails grow at a very slow rate, which is about 3 millimeters per month for our fingers and 1 millimeter per month for our toenails, which ultimately leads to a duration of about 4 to 6 months to fully regrow our fingernails and 12 to 18 months for our toenails. Our nails are about 1,000 times more permeable to water than our skin is. Film forming systems are non-solid drug formulations that produce a film on contact when applied. These formulations typically have a drug in a quick-drying solvent to form a solid, transparent film polymer. Four common elements include the active pharmaceutical ingredient, the solvent base, a plasticizer, and the film-forming polymer. Transungual delivery systems utilize this dosage form to get active pharmaceutical ingredients across the nail plate to reach the nail bed and the nail matrix. This film acts as a drug reservoir, allowing for slow release of medication, which increases keratin permeation through adhesion and reduces nail water loss, which aids in drug diffusion. A common example of film-forming system is cycloporox 8% nail lacquer. Liniments and collodions are non-aqueous topical liquid formulations. Liniments are alcoholic or oleaginous solutions or emulsions that are intended for rubbing into the skin. Liniments containing alcohol are utilized for their rubefacient and counter-irritant effects, A rubefacient is a topical agent that causes local irritation and reddening of the skin by increasing blood flow to the application site. Oleaginous liniments are intended to be massaged into the skin. They are typically made from oils such as almond, peanut, or sesame oil. Due to liniments' irritating effects, they should not be applied to damaged skin. As an example, Tiger Balm liniment only has 5 ingredients total, 2 active pharmaceutical ingredients and 3 inactive ingredients. The inactive ingredients are eucalyptus oil, spike lavender oil, and light mineral oil. This liniment is designed to be massaged. Collodions are a liquid formulation of pyroxylin in solution of alcohol and ether, and it's considered highly flammable and should be stored appropriately. Pyroxylin is a form of nitrocellulose derived from cotton treated with acids. Collodions can provide a protective coating on the skin, which can be applied to sutures to make them waterproof, or they can be medicated, as is the case for liquid wart removers containing salicylic acid as the active pharmaceutical ingredient. Sticks are cylindrical solid preparations that melt on contact with our skins. To expose the contents of the container, most sticks require a twisting of the base dial, which pushes the solid stick formulation upward. Common examples include lip balms and deodorants. The active pharmaceutical ingredient is embedded in a semi-solid waxy base. The materials chosen determines the stick's physical appearance. Examples of ingredients used to make opaque sticks are petrolatum, cocoa butter, and polyethylene glycol, and those for translucent sticks contain bases derived from sodium stearate, glycerin, and propylene glycol. Topical powders are dry, solid, fine particles that are intended for external administration. These powders should be freely flowing and impalpable, which reduces irritation to the skin. If you watch my entire dosage forms videos, I went over how the United States Pharmacopoeia classifies powders based on their size. In this case, to be considered impalpable, if it passes through a sieve number 100 or finer, it's considered impalpable. Powders are placed onto the affected areas using a sifter type container or a powder aerosol container. Sifter containers are bottles or jars with a mesh that regulates the powder flow, a typical example being Johnson's baby powder. Powdered aerosol containers hold the particles suspended in a gas such as tinactin's powder spray. Bases used in topical powder formulations include cornstarch or talc. Topical powders are useful in absorbing sweat and providing a cooling sensation. And that was your dose for medication education. I hope you enjoyed today's video. If you did, please give me a like and subscribe. I would like some feedback for those of you who are watching my videos. What is it that you like? What don't you like? Either way, have a great day, and the references are to follow.